So we do have surveys that go out. We've done some EHR related surveys to understand specific pain points, and we've done that multiple times over a period of several years. Specific to AI, we have surveys about changes, and I will say we're framing it as here are changes that we're making to the EHR that we think will make your experience better. Are they
Hmm.
actually making it better? And we have some
Hmm.
specific questions that we ask to understand that. We've had some focus groups where we've had staff piloting the tools that we're implementing, and we can actually spend time with them, to understand and kind of talk about what their experience is. And then we always have like an open door policy with our leaders across the different areas. And so anytime they can talk to clinic managers or people connected to the project team, and we make sure that there's a feedback loop that's in place so that we're hearing that as we go, because we really wanted to take that feedback throughout the entire implementation of these tools. And we're about 8 months in, or maybe six to 8 months in. And so we wanted to be sure that we had that feedback, a healthy feedback loop in already standing as we got started, so that if we needed to make changes to what we were doing, that we weren't waiting 6 months or a year to understand that we could go ahead and make that tweak or that pivot to our plans right away.